What's up, everybody? This is Daniel from ATP Fitness, and today we're going to talk to you about something that affects people all across the world, no matter what size, shape, or age, and that's low back pain. One of the main contributors to low back pain is actually not necessarily going to be the low back, and it's going to be the pelvis. We call this the lumbopelvic region, which is low back to hips, this region right here. And what you'll find is that a lot of people will either have their hips shift left or shift right. And this, whichever way they shift, the other side is going to end up shutting off your muscles in certain regions. So for instance, Baron, his left leg is longer than his right. That means that his hips are going to shift over towards the right slightly. And what happens is that his right glute ends up overfiring, his left glute ends up what we call glute amnesia, so it's inability to fire. Because that glute doesn't fire, then what we do is we see internal rotation of the knee, which often causes tightness within his adductors, and then we could see pronation down at the foot and ankle joint. And all this is because his body is trying to create equilibrium because it's shifted to the right. If all this stuff on his right side is contracted, then stuff on the left has to shut off. Vice versa, whichever way it goes. So understanding these points is going to help you work out a lot safer, more effectively, and hit your goals quicker. So what we'll do now is I'm going to show you actually how to find out which leg is longer than the other. Okay, so to determine which leg is longer, you want to lay on the ground, and it's best to have somebody looking over you, and you want to take a look at their knee joint and their ankle joint. So from here, if we zoom in and we get closer to the knees, we can see that Baron's left knee is hanging down a little bit lower. So right over here, this knee is lower, meaning that his left hip is drooping down. And to confirm that, you want to go down to the feet, and you can really see it in the feet. You can see his left foot is much lower than his right. I would give it a good inch or so. So this is the first step to fixing the hips, is determining which leg is longer. All right, so we have predetermined that Baron's longer leg is his left leg, so his pelvis is drooping down towards the left. So what we want to do is we're going to basically pull the right leg out of his body. So this is an exercise that you can do either by yourself, or it's a little bit more effective when you do have a partner doing it. But what Baron's going to do is he's going to place his right leg on the wall, okay? And what he's going to do is he's going to take a very deep breath, hold it. He's going to exhale everything forcefully out of his lungs, and when he does that, he's going to drive into the wall. Okay, we're going to try it again. Deep inhale, drive down to the ground, and drive into the wall. And as he's doing this, he's feeling his pelvis shift from left to right. And so we're trying to get this pelvis to move. Okay, you're going to do that 3 times. After that, we're going to do the exact opposite direction. So now I want Baron to place his hands on his leg, and now he's going to pull his knee towards him as he pushes. Same exact breath work, same exact pattern, just the opposite direction. And this is the one where you're going to feel most of the work. What he's doing is he's pushing through his oblique, because this is the weak oblique right here. And as he does this, you can even see him shaking a little bit because his pelvis is sliding into that neutral position. Maybe one more. Okay? So you just relax right there. So what essentially we're trying to do, his hips are down like this, and we're trying to make them move back this way. The third one is going to be, it's a little hard to do on your own, so if you do have a partner, this is probably one that you want to grab them for. Baron's going to place both his feet on the ground, and we're going to work on his adductors. So because this hip is lower, and this internally rotates at this knee, this adductor is usually tight, this adductor is usually weak. So what we want to do is we want to even it out by engaging this adductor more so that his pelvis will then shift over towards the left. So what Baron's going to do is he's going to open the knees up slightly, and he's just going to apply pressure against my hands. Nothing much, relax. Okay? Just so that there's pressure into my hands, but he's not moving. Then he's going to take a very deep breath, exhale, and then squeeze his knees together as he does it from his adductors all the way. He's going to close his knees completely. Good. We're going to open up again. Deep breath, exhale completely. Drive the knees together all the way. Close them, close them, close them, close them. Good. And one more. Deep breath. And exhale forcefully, close those legs. Very good. So what happened is that this adductor, I could feel it when I'm holding him here, it was much weaker. And he has to consciously think about engaging this more and not using the strong adductor so much. And we can see that his pelvis then shifts over to the right. After you do this, you want to go lay back on your back, do the same assessment, check your knees, check your ankles, and then make sure that they're even. If they are even, then you should feel a little more symmetry through your glutes, knees, ankles, and you can go squat, deadlift, do anything on 2 legs. But always take care of your asymmetries before you go ahead and try to do any kind of double leg stuff.